Welcome back to the podcast. Today I want to talk specifically about healthcare organizations, providers, payers, and health systems, and focus on one cyber risk that is often underestimated because it doesn't always shut systems down immediately. According to the March cyber risk forecast, ransomware remains the top cyber threat at healthcare because it directly disrupts patient care. But the second riskiest type of attack, and the one that often creates long-lasting financial and regulatory damage, is the large-scale patient data breaches, the exposure or theft of protected health information. Now, this includes breaches of electronic health records, patient portals, billing system, and third-party processors. So today, I'm going to quantify that risk using publicly observable data and the forecast's probability bands and one critical assumption. So if your organization's security maturity is roughly average for healthcare industry, then these numbers absolutely represent your risk. So let's start by defining the risk clearly. In the March forecast, we referred to the healthcare data breach as not talking about small contained incidents involving a handful of records. Instead, what we're talking about are the large-scale exposure of patient data, tens of thousands, hundreds of thousands, or even millions of records, whether through a direct system compromise, a credential abuse, or third-party access. And here's the first uncomfortable truth. Healthcare is one of the most consistently breached sectors year after year, and this is according to public reporting and regulatory disclosures. Now, that's not because healthcare organizations are careless. It's because healthcare environments are highly interconnected. They are operationally constrained, and they're built to prioritize access and availability over tight control restrictions. So let's talk about how to quantify the likelihood. In the March forecast, large-scale data breaches in healthcare sit at the high likelihood band. So that's roughly around 60 to 80% probability within the forecast horizon. So this trend direction matters. In that forecast, it shows the risk as high and stable for the next 30 days, high and persistent through the next 60, and remaining high for the next 90 days. Now, this tells us something very critical. This is not a spike in risk. This is structural. The drivers that we talk about in the forecast and that you see and hear in public data are familiar. They're credential theft, phishing, exploitation of known vulnerabilities, and delayed detection of data exfiltration. So let's talk a little bit about the publicly available data, because this is where the quantification becomes real. Healthcare data breaches are not hypothetical. They are reported, tracked, they are disclosed. Public breach data reports show that healthcare breaches routinely involve tens of thousands to millions of patient records, that the discovery often takes weeks or months after the initial access, and the majority of large breaches do not involve sophisticated zero-day exploits. Instead, they involve stolen credentials, misconfigured systems, or third-party access paths. If your controls are close to the industry baseline, your average then this publicly reported data is not somebody else's problem. It is a proxy for your risk. Now, let's quantify the impact, and this is where organizational size matters. The financial impact of healthcare data breach is driven by the number of patient records affected, the time it took to discover it, and the regulatory and contractual obligations that follow. So publicly reported cost ranges for healthcare breaches consistently show multi-million-dollar impacts for large incidents. These costs include breach investigation, patient notification, credit or identity monitoring, legal and regulatory responses, and the long-term reputational damage. And the costs scale with size. So, for a small healthcare organization, a breach involving tens of thousands of records may threaten operational stability. For a mid-sized provider or a payer, the same type breach can push costs into the high seven figures. And for a large healthcare system or payer, a large-scale breach routinely costs in the eight-figure financial impact once regulatory response and long-term remediations are included. Now, probability may seem similar across the healthcare organizations, but the financial impact is not. So next, let's talk about the exposure. If we take the forecast's high likelihood band, roughly 60 to 80% likelihood, combine it with the publicly observed breach costs, we get an exposure envelope, not a single number. Think of it as a range because it is a range. For smaller organizations, exposure may land in the low millions over time. For mid-range organization, exposure grows into the mid to high millions. And for large organization, exposure becomes a material balance sheet and governance issue. And this exposure issue, even if you are average with everybody else in the industry as far as security, this is applicable. That's all taken into consideration. Now, many healthcare leaders assume that if they haven't experienced a major breach recently, that their risk must be lower. And what this forecast shows is that this thinking needs to be challenged. Large healthcare data breaches are often discovered long after the initial compromise and public visibility only once the damage is already done. So absence of evidence is not evidence of absence of an attack. If your controls mirror the industry average, your exposure mirrors the industry outcomes, is what I'm saying. Controls like identity protection, monitoring for unusual access patterns, segmentation of patient data, and third-party oversight all reduce risk. But what the forecast is telling us, what it makes clear is that controls reduce severity and duration, not the existence of the attempts. That's why breach quantification in healthcare is about how much data is exposed before detection, not whether the attackers get in at all. So ask yourself, how quickly would you detect unusual access to large volumes of patient records? How much data could be accessed before alarms trigger? How many systems or partners have access to patient data by default? These are financial exposure questions. The longer access goes unnoticed, the larger the breach and the greater the regulatory, legal, and reputational costs. So now let's look at some time periods. Over the next 30 days, the forecast shows no meaningful reduction in healthcare breach activity. Over 60 days, looking forward, risk remains elevated as attackers continue to exploit credential-based access. And over the next 90 days out, the forecast predicts a persistence, not relief. So this is not about waiting for the threat landscape to calm down, because it's not going to happen. Instead, this is about deciding how much exposure your organization is willing to tolerate. At a high level, it's enough to know that healthcare data breaches are highly likely. Average security equals average risk, and size determines the financial impact. This is a good way to think of this and to communicate this. But when it comes to deciding how much to invest and where to prioritize, surface awareness is not enough. That's where deeper quantification becomes valuable, not to predict perfectly, but to make informed trade-offs. So according to the March forecast, large-scale patient data breaches are the second riskiest cyber threat to healthcare, behind ransomware. They carry a high likelihood, they remain persistent over the next 90 days, and and produce financial impacts that scale directly with the organization size. If your security maturity matches the healthcare industry's average, then these risk outcomes absolutely apply to you. And the real question is not whether the threat exists. The question is how much exposure your organization is carrying right now, and whether leadership understands what that means in financial terms. I hope you like this. If you do, please subscribe, and I will see you in the next video.